Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Preparing your child for surgery. Introduction. This program will help you prepare for your child's surgery. By understanding the different steps as you prepare for the surgery, you can help your healthcare providers increase the chances for a successful operation and a fast recovery. Planned surgery involves 4 distinct steps: surgical consultation, pre-surgical visit, day of surgery, and patient discharge. During the surgical consultation, the patient and his or her parents meet with the surgeon to discuss the surgical treatment options and discuss the benefits and risks of surgery. This program is designed for parents of patients who have already been scheduled for surgery. The purpose of the pre-surgical visit is to check the medical condition of the patient and to plan for anesthesia. This program discusses what happens during the pre-surgical examination and the medical questions you may be asked. On the day of surgery, you will check your child in before going to the operating room. After the operation, your child will be monitored in the post-anesthesia care unit or recovery room. This program describes what your child will experience during the period surrounding the surgical process. After surgery, the patient often goes home the same day, but may be required to stay at the hospital for additional care. When patients go home, they are given instructions. This program reviews some of the information you will be given when your child is discharged. Waiting for surgery. After you have made the decision for your child to have surgery, there may be a waiting period of as little as 1 day or as long as several weeks. The following section discusses some tips to help you prepare for your child's surgery. Find out from your child's healthcare provider whether your child is going to be an outpatient or an inpatient. Outpatient means that the patient goes home the same day that the surgery is performed. Inpatient means that the patient stays in the hospital after the surgery for 1 or more days. This is often discussed during the surgical consultation. The surgeon will tell you the dates of your child's admission and surgery. If you have other children to take care of, make arrangements for someone else to take care of them while you're in the hospital. The surgery schedule is finalized the last business day before surgery. You will receive a phone call with information regarding the time of surgery and your scheduled arrival time. Your healthcare provider will tell you if there is a risk of a large blood loss during surgery. Sometimes this can require a blood transfusion. If your child is healthy and the operation is more than 4 weeks away, you might have the opportunity to store some of the child's own blood in case a blood transfusion is needed. This type of blood transfusion is known as autologous blood transfusion. You will be informed during your surgical consultation if this option is right for your child. Always try to tell the truth to your child about their operation. If your child asks a question, be honest when you answer. If you do not know the answer, tell your child you do not know and ask your nurse or healthcare provider for help. Honesty will increase the faith and trust that children have in their parents and the medical team caring for them. Pre-surgical visit. Most patients are admitted to the hospital on the day of surgery, but in some cases, the patient may need to be admitted the day before. During the pre-surgical visit, a member of the anesthesia team examines your child and reviews his or her medical history. He or she will do a physical exam and ask you questions regarding your child's health. Blood and urine tests as well as other tests may be needed. It is important to let your healthcare providers know if your child has had any special medical tests in the last 6 months. You may be asked to bring the results or have them sent to your healthcare provider. Be prepared to answer a lot of questions. On the following pages are some examples of questions you might be asked. What prescription medications is your child taking? Is the child taking any non-prescription medications or herbal medications? Does your child have any allergies to drug or food groups? If yes, what is he or she allergic to? Is your child allergic to latex? Latex is a substance found in many hospital and surgical accessories. It is possible for your healthcare provider to avoid exposing your child to latex if he or she has latex allergy. Has your child had anesthesia before? Do you know if any blood relative of your child has had problems with anesthesia? You should tell the anesthesiologist about any medical problems that your child might have, such as asthma, heart disease, diabetes, seizures, other nervous system abnormalities. Please report any recent changes in your child's health, including colds, fevers, flu, nausea, vomiting, exposure to communicable diseases such as measles or chickenpox. Medications your child may be taking could interact with anesthesia or could cause excessive bleeding during surgery. Therefore, it is very important to tell the anesthesiologist and surgeon about any medications your child may be taking, even over-the-counter medications such as aspirin, Advil, or herbal supplements. If your child takes medications, find out which ones should be taken before surgery. The healthcare provider may ask you to change the schedule and dosage of your child's medications before the surgery. The anesthesiologist will determine the best anesthetic for your child. Anesthetics are medications that are used to keep the patient comfortable and pain-free. There are 3 basic types of anesthesia. 1. General anesthesia. 2. Regional anesthesia. 3. Local anesthesia. General anesthesia causes the patient to go to sleep and not feel pain. General anesthesia is either given through a mask or an injection. Regional anesthesia is used when a whole region of the body, such as an arm or leg, needs to be numbed or anesthetized. Examples of regional anesthesia include spinal anesthesia, epidural anesthesia, and nerve blocks. Local anesthesia is used for numbing specific limited regions of the body, such as a skin area. Dentists use local anesthesia to numb the nerves of the teeth. The risks depend on the type of anesthesia and on the child's current medical condition. The healthcare provider will discuss these risks with you. You can do a lot to prevent complications by telling the healthcare provider about your child's allergies, medications, and diseases. Anesthesia is safe, but there are some possible risks and complications. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. The night before surgery. Your child will be asked to stop eating and drinking several hours before surgery. This is important for your child's safety while going to sleep with anesthesia. Make sure to ask your anesthesiologist about specific eating restrictions before your child's surgery. These restrictions differ depending on the age of the child, his or her general health, and the type of anesthetic given. The following eating guidelines before surgery may not apply to your child's specific case. Solid foods. No solid foods after midnight the night before surgery. Milk or infant formula. No milk or formula for 6 hours before surgery. Breast milk. No breast milk for 4 hours before surgery. Clear liquids. No clear liquids for 2 hours before surgery. Feeding should be finished before the designated time. For example, if your child's surgery is at 8 a.m., clear liquids should not be taken after 6 a.m. The last clear liquid feeding should be limited to 2 ounces in infants and no more than 4 ounces in older children. Examples of clear liquids include water, fruit juices without pulp, carbonated beverages, infant electrolyte solutions such as Pedialyte. A simple definition of a clear liquid is a liquid through which you can see printed material. Your child may be worried about coming to the hospital. How your child handles being in the hospital will depend on his or her age, developmental level, and past experiences. How you react will also affect your child. It is helpful if you try to be calm and matter-of-fact about tests and exams. Your child may be anxious before the surgery. You can help your child through this stressful time by talking to him or her about the surgery in advance and answering questions honestly. Despite preparation, some children may require medication to calm them before surgery. The type of medication may be given by mouth, nose, rectally, or by IV. Your anesthesiologist will decide if this is needed. Day of surgery. On the day of surgery, your child will be admitted to the surgical area and an identity bracelet will be placed around his or her wrist or ankle. Please do not remove it or get it wet. It is best to wear simple, loose-fitting clothes that will easily fit over a bandage. It is also best to leave jewelry and other valuables at home. If your child has an inhaler or nebulizer, please bring it on the day of surgery. Bringing a favorite blanket or toy will also help to make your child feel comfortable. A healthcare provider will review your child's medical history and perform a brief physical exam. Minor illnesses such as colds may postpone surgery. The healthcare team wants to make sure your child is in the best possible physical condition for the procedure. Older children may be questioned regarding any hidden body piercings, and girls will be asked about possible pregnancies. Be sure to tell a healthcare provider if your child did not follow the eating guidelines before surgery. For your child to have surgery, you need to sign a consent form. Signing the consent form indicates that you know what the surgery is for and that you understand what the benefits and risks are. This will allow your child's healthcare team to proceed with the surgery. During surgery, your child is given a gown to wear. You will then meet the anesthesiologist. He or she will be in charge of your child's anesthesia care throughout the surgery. Your anesthesiologist may give your child a sedative to relax him or her before going to surgery. Though your child may still be able to walk, he or she might be taken to surgery in a wheelchair or on a bed, also called a gurney. This ensures safer transportation. Your child may be taken to a surgery waiting area, called a holding area, before going to the operating room. From the surgery holding area, your child will then be moved to the operating room, also known as the OR. The anesthesiologist will help decide if your child might benefit from you being present in the operating room. At times, children's fears may be increased if they are separated from their parent. The anesthesiologist will consider your child's medical condition, age, developmental status, degree of anxiety, willingness to cooperate. If the anesthesiologist does decide that a parent should be with your child, we ask that only one parent go with your child into the operating room. It is easier for the child to focus on one parent when anesthesia is started. The anesthesiologist needs to focus carefully on your child when beginning anesthesia. You can help by making sure you are comfortable with what to expect after the anesthesia begins. Children often cry at the start of anesthesia when the mask is first placed near their face or when they begin to notice changes in the environment. They will go to sleep relatively fast, and then the parent will be escorted from the induction area or the operating room after the child is asleep. There are different methods to begin the anesthesia. The safety of the child is most important in deciding what method is chosen. IV medications may be used. Infants and young children most commonly go to sleep by breathing special gas through a mask. In cases of general anesthesia, after the child goes to sleep, a tube may be placed in the throat to help continue breathing. In cases of regional or local anesthesia, your child will be given some medication through an IV for relaxation. The anesthesiologist will then inject the actual numbing medication into the appropriate area. It will numb the area and make it so that your child does not feel the surgery. Your child will be closely monitored in the operating room. The anesthesiologist or nurse anesthetist will continually monitor your child's blood oxygen level, pulse, blood pressure, respiration. They will give your child any medications, fluids, or blood that he or she needs.
Some of the equipment that is used to monitor your child's vital signs include a blood pressure cuff to monitor blood pressure, a finger clip or sticky pad known as a pulse oximeter to measure blood oxygen level, EKG patches on the chest to monitor the heart, an intravenous line or IV line to give your child the fluids and medicine he or she needs.
Immediately after surgery. After surgery, your child will go to a recovery area. Some children may need to go to an intensive care unit. In most cases, parents are allowed to be present when the child is awakening in the recovery room. You will be instructed when you may join your child. Some healthcare facilities have an outpatient recovery room where your child may be able to spend a few hours before going home if he or she is an outpatient. To protect the other patient's privacy, remain at your child's bedside. The nurse will check your child's condition frequently and answer your questions. Your child may look different after surgery. He or she may appear puffy, flushed, or pale, and may have one or more of the following: an IV tube for fluids and medications, dressings over the surgery site, tubes or drains to remove fluids. General anesthesia reverses rapidly, but complete recovery of thinking processes following an anesthetic may take 1 to 4 days. The concerns in the recovery room are primarily focused on the heart and lung function, pain treatment, and watching for any problems related to the surgery or anesthesia. Your child may wake up restless, agitated, or crying. Some effects may last up to 24 hours, with the possibility of the child having sleep disturbances, nightmares, or loss of bladder control the night after surgery. If your child is staying overnight in the hospital, the nurse will be checking on your child frequently during the night. This may interrupt sleep but is important for your child's recovery. The area where your child had surgery may be tender or painful. Medicine will be available to help relieve pain after surgery. Pain medicine will be provided for your child. Please let the nurse know if you think your child is in pain. Being comfortable will make it easier for your child to recover. You or your child may be asked to use the number scale or face pictures to identify pain or discomfort. Nausea and vomiting are often common after surgery and anesthesia. IV fluids will be given during and after the procedure to ensure that your child has had enough fluid by the time they are ready to go home. If your child does not want to drink any fluids, do not force him or her to drink. If your child will be going home the same day of surgery, he or she should be able to drink fluids without nausea and vomiting. When your child is awake, he or she will be offered oral fluids to drink. Most children are able to do this within a few hours. Rarely, nausea and vomiting will require a child to remain in the hospital. Discharge instructions. If your child is an outpatient, he or she will be able to go home on the day of surgery. If your child is an inpatient, he or she will be discharged to go home after recovering at least one night in the hospital. You can do a lot to help speed up your child's recovery. Your healthcare provider will give you specific instructions. These are called discharge instructions. The following are some general suggestions. You will be given instructions regarding what your child can eat and how your child can slowly progress from drinking liquid food to eating solid food. Follow these instructions until your child recovers from the effects of the surgery and anesthesia. In the hospital, if your child feels any pain, ask the nurse for pain medicine. When you go home, do not double up or increase the dosage of your child's medication without asking a healthcare provider. Depending on the type of surgery and anesthesia your child had, your healthcare provider may give you additional instructions. Do not be afraid to ask any questions related to your child's health and recovery. Here is a list of 8 common questions you should ask your child's healthcare providers before you take your child home. 1. What medications should my child take and when? 2. What are the signs of infections and other common complications? 3. What should my child eat? 4. What will happen to my child's stitches and/or staples? 5. When will my child see their healthcare provider again? 6. When can my child go back to school or daycare? 7. When and how can my child shower? 8. Can my child play and bend? Make sure to ask your child's surgeon to share the summary of his or her hospital stay with his or her family physician or pediatrician. You should also ask for detailed information about which medications your child should take when he or she goes home, whether there has been any change made to your child's home medications, whether your child is allowed to resume medications he or she might have been asked to stop before the operation. Such medications may include blood thinners.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. By understanding the different steps as you prepare for the surgery, you can help your healthcare providers increase the chances for a successful operation and a fast recovery. Planned surgery involves 4 distinct steps: surgical consultation, pre-surgical visit, day of surgery, patient discharge. Find out from your child's healthcare provider whether your child is going to be an outpatient or an inpatient. Outpatient means that the patient goes home the same day that the surgery is performed. Inpatient means that the patient stays in the hospital after the surgery for 1 or more days. Your child will be asked to stop eating and drinking several hours before surgery. This is important for your child's safety while going to sleep with anesthesia. Your child may be worried about coming to the hospital. How your child handles being in the hospital will depend on his or her age, developmental level, and past experiences. How you react will also affect your child. It is helpful if you try to be calm and matter-of-fact about tests and exams. The anesthesiologist will help decide if your child might benefit from you being present in the operating room. At times, children's fears may be increased if they are separated from their parent. The anesthesiologist will consider your child's medical condition, age, developmental status, degree of anxiety, willingness to cooperate. You can do a lot to help speed up your child's recovery. Your healthcare provider will give you specific instructions. These are called discharge instructions. Here is a list of 8 common questions you should ask your child's healthcare providers before you take your child home. 1. What medications should my child take and when? 2. What are the signs of infections and other common complications? 3. What should my child eat? 4. What will happen to my child's stitches and/or staples? 5. When will my child see their healthcare provider again? 6. When can my child go back to school or daycare? 7. When and how can my child shower? 8. Can my child play and bend? Thank you for using Explain.